The one thing that we would be extremely concerned about if any loved one of ours, especially over the age of 65, was sick and hospitalized. We are going to have an open discussion here, which hopefully you can learn a lot from. And if and when, hopefully not anytime soon, that day comes when you or a loved one is hospitalized, please keep in mind what we talk about. And for anyone who enjoys our discussions, please check in the links down below for our separate unique channel, where we do post a lot of separate exclusive content, all relevant to your health and well-being. All right, Dr. Peter, you want to go first. If a loved one of yours over 65 was sick and needed to be in the hospital, what would you be very concerned about?
That's a great question, Suneel. I think as any patient would ask me as a doctor is like, what would you do if it's your parents? And so I think if it was, I would say my parents as an example is who would be their advocate? And I think that worries me the most in the hospital is as someone who is not in the healthcare system and who has so many doctors going in and out and who is actually going to be questioning if they're doing the right thing, if they're being given the right medications. I mean, we just assume when you're in the hospital that all the medications, everything are right. And I've seen so many disasters and really just awful things happen in hospitals when people just assume. And I think the number one thing I would say is being, and who would be my mom or my dad's patient advocate. I have a really kind of story that hits home on this point, and it's my mom who had a really bad fall. She's very fit, she's very active, and she broke 3 extremities. And fortunately, she's doing much better now. And it just shows you how things can change in a minute. But, one of the things she had broken was her wrist. And so she went for surgery for her wrist. And what was supposed to be a relatively lower risk, low pain surgery, what happened is the anesthesiologist did a nerve block. So they basically injected a medication to block the nerves so they don't have pain in the wrong arm. And you don't think that this stuff happens these days. And especially, when you feel like you trust the person taking care of them, but she had a complete block in one arm and you can't do a nerve block in the other arm. So she had to have a local area numbed. And because of that, the pain after the surgery was excruciating for her. Mm-hmm. And just the anger that really made me is that was just such a medical mistake. And that my mother was saying, oh, it's okay, mistakes happen. And I think that was kind of the feeling that she told the nurse who was the one that informed her of it, not actually the doctors. And not even the anesthesiologist told my mom that it was a wrong arm. It was actually the nurse. So, good for her. She was actually the only advocate for my mom. But just a bigger picture, you can see, I don't expect different care from my parents because I'm a doctor, but I do expect like quality of care. And this was a total disaster because no one stood up for her and someone who didn't follow the proper checklist of why we make medicine safe. And this happened.
And that is a very scary story, actually. So you feel that if there was an advocate there by her side, it would have made all the difference.
Absolutely. I think that, she's not to question or doesn't think. And I think a lot of patients are like, oh, why should I be questioning? Are they, someone was giving an injection in the wrong arm. And yeah, she could have spoken up and been like, well, isn't it my other arm? But how does she know that what he was giving her was the anesthetic, the numbing medication in the wrong arm? She just thought it was when people are not, she's not trained to know that.
That's true.
And I think that can happen with regards to the wrong medications being given, the wrong time. I mean, medications have been forgotten in the hospital or not told correctly, or just, there's so many different steps within the hospital from an emergency room to the floor where it's like that game, of telephone where you tell someone one thing and by the time it makes it away around the room, the story has changed. And that can happen tremendously in medicine because every time we know that, yes, doctors can work long shifts, but we also know that the more shift changes you have with a patient, sometimes the quality of care or mistake errors can happen. You need someone there by you who can at least do a check balance to make sure that things are okay and you're getting the right medications.
Yeah, absolutely. And it's such a great point that I believe we've talked about previously, the difference between an advocate by your side if you're ever sick in the unfortunate position of being in the hospital. It is a true blessing to have a loved one by your side. And I always emphasize to anybody when you're in this position, any loved one, whether it's your wife, husband, child, parent, sibling even, if you're there by the bedside and just double check on everything and do not care one little bit about the feelings of the healthcare staff, be there watching everything and double checking on the behalf of your loved one. Would you agree with that, Ben?
Oh, I couldn't agree more, I think. But if you can't have an advocate, then you have to be your own advocate. And that means speaking up. And if you don't understand what someone's doing or why they're doing it or what test was ordered or who's seeing you, you have the right, and I think the duty to yourself, to speak up and say, why are we doing this? Why are you touching this arm? I thought it was the other one. And if they provide a reasonable explanation, great. But you really have to protect yourself. I would strongly advocate for that.
Yeah, thank you for that, Dr. Peter. That was a really profound story. So, Dr. Ben, would you like to share your biggest concern if your loved one over the age of 65 was in the hospital?
So Peter alluded to it multiple times and kind of said a little bit about this, but wrong medications. Now, he was talking more about medications administered to you for procedures and things like this. But one of the big ways that hospitals can make mistakes is with your home medications. And you have many of you probably come in with a very specific list of medications that you take every day. Most of them, probably, if you're still taking them, are important and you're taking them for a reason. And if they're not recorded properly and you get the wrong medications or they miss medications, it can be devastating. I mean, there are patients that are not on or are on blood thinners to prevent a clot from forming, or they're not on a blood thinner and it started in them, which can be very dangerous. We've talked in previous videos about very bad things that happened where completely different classes of medications were administered by accident. Heart medications were mistaken for insulin. That was a story we told once, which was devastating. So wrong medications is extremely important. Now, your primary care physician will have a list of your medications, and that's probably the most accurate source. They're kind of your quarterback. They should know everything. But that has to translate over when you come into the hospital, and that can get really messy. So if your cardiologist or whoever, endocrinologist or somebody changed or put a different med in and that wasn't quite recorded, they may not know. They may not see it when they check the medications. It's assumed that your electronic medical record carries over very nicely, but there can be mistakes there. So what I would advocate is that you know what your meds are and make a list. Know what they are and have a list, have it in your wallet, have it in your purse, have it in a little card. So if ever you need to pull it up, this is what I'm on, this is up to date. I promise you there's nothing else. This is all I take. You will be much better protected that way, but also ask. So if a nurse is administering a med, which one is that? How many milligrams? Okay, yeah, that's what I take. It's important.
It is, yeah. And it can be life-saving. And a lot of times, we've talked about this before as well, medications might need to be changed when somebody is sick. Maybe a blood pressure medicine needs to be reduced, but the team absolutely needs to know what medicines you are on at baseline. And there's so much, I call it basically fake news in terms of medications when people look at the computerized system. Because back in the good old days, everything was written down, double checked. Now it's just, let's pull it off the computer, and the computer isn't accurate. So
that's so true, and that's actually a really good point. So
dangerous.
With the advent of like electronic health records, what's happening now is, you're right, in the past, and I was fortunate to be trained and practice some of my career when there's paper charts. So you'd be writing something physically down and they would be taking it physically off and doing the order. Now it's all about clicking. And you don't really, I could be in the other side of town and write an order through an app on the phone that will give an order that so you can order stuff without actually having to talk to the nurse. And I think that is a big fault of medicine right now, is that we're able to bypass nurses and just put orders in. Whereas before, I think that, and it's so important because they're they're really like the gatekeepers and really I would probably say probably the best advocates in the hospital are the nurses.
Absolutely. Oh, yeah.
And to have to be able to bypass some with electronic health records to order a medication or change in treatment without having to tell them directly is a big problem.
I completely agree. I mean, nowadays, what the doctor simply puts the order in the computer, they might not be physically even in the hospital when they do that. And the nurse will go and follow that order. By the way, I know a lot of people in the UK and overseas find it funny when we use the term order because it's not called orders over there, but very much in the United States, it's called doctor's orders, order entry, and the nurse has the order to go ahead and administer something, and that conversation won't happen. And there's these protocols, like I've talked many times about my concerns about blood pressure parameters. Like this is pretty standard across the United States. The doctor will write, hold the blood pressure medication if the systolic number, this is the top number, is less than 100. So guess what that means? The nurse goes around, and if the top number is 103, which is still low, they will give 3 blood pressure pills. And before you know it, the blood pressure is in the 80s, and it's well known, a saying by nurses, seasoned nurses will tell you the time for a rapid response is 30 minutes after the med pass. And it's a total lack of thought. What are your thoughts on that, gentlemen?
That's a really good point because, I mean, it's a very standard thing that doctors do.
Yeah.
Heart rate less than 55 or blood pressure, systolic, the top number less than 100. So like say your heart rate's 56 and you're given a bunch of medication to slow down your heart rate. Now it's just an example of how medicine can be algorithmic where we're not actually truly thinking about what could happen. It's just, this is the way that everyone else does it. So this is the way that I'm going to do it.
Okay, everyone, I'm going to interrupt that tremendous discussion for a moment to tell you about our expanding health and well-being store. I'm very proud of our natural, uniquely formulated products. Check in the links down below. We've got our natural anti-inflammation immune support, bone support, memory support, heart support, and sleep support. Also, our newly released organic chai mix based on the tea that I regularly drink. We are made in the USA and very proud to be working with a veteran-owned company. ohighwellness.com if you're in the USA, North America. ohighwellness.co if you're in the UK, Europe. All right, back to the discussion.
But it just shows that algorithms and protocols are, you do need them to some degree to try to standardize, but nothing replaces a thinking, experienced human being that's been trained. So if you have a nurse that's seasoned, been trained, knows what she's doing, she's going to say, hey, what in the world are you doing? We're not giving these medications. This is going to make them crash. I've seen it 100 times. You have a new nurse or a new doctor who's not paying attention. That's where these things happen. But the problem is, I think the system does its best to standardize the care, but in the end, it's humans, and to err is human.
That's right. And you have a standardized system where the human body is non-standardized. Everybody is different. And we've lost so much in our rush towards automation, everything being computerized. I mean, back in the day, many of you remember those days, the good doctor who knew you out in the community would visit you in hospital and say to the nurse, hey, look, what is this medicine? This should be different. So-and-so. And they knew the patient. Those days are long gone. It's so very sad what has happened. And I believe that it is to the detriment of good medicine, and you will know that as well. Let me tell you my number one thing then that I would be very concerned about if a loved one of mine was in the hospital who is over the age of 65 especially. And it is what I call sinking in bed syndrome. I should patent that term. I have mentioned this in prior videos, but I would be very concerned, and I've seen this happen so many times, and it will literally take someone who's in their 70s or 80s from being independent to in a nursing home within a few weeks. So I'll paint a scenario for you. An older person, by older, we're talking about over the age of 65. We know many of you watching are in amazing shape, and we want you to stay that way, but we're saying, for argument's sake, someone over the age of 65 has a pneumonia, picks up a lung infection, and they come into hospital and they're wiped out. They got what we call sepsis. So most patients who come into hospital with infection will technically have sepsis, and that just means you fulfill criteria for a severe infection. It doesn't mean that the infection is spread to the blood. just means you have a severe infection. You end up in the hospital. Maybe you need oxygen for a day. And hospitals everywhere are astoundingly bad at getting people out of bed. This is why I call it sinking in bed. So somebody who's, let's say 73 years old, who is fully independent, will be there on hospital day 2, hospital day 3, and they barely moved, and their infection is getting better. By hospital day 5, they've still barely moved. So guess what's happened? They become really deconditioned, and actually somebody who's 22 would get deconditioned if they lie in bed for 5 days. But can you imagine that affect age 73? And the scenario goes like this. They'll be recovered from their infection. They wouldn't have got moving. And of course, when you're sick, you might not feel like getting moving, but you need a push. And they don't go home. They go to rehab. Then in rehab, they get another complication. And before you know it, they've lost their independence. The amount of times I've seen that happen is nobody's business. So I would really emphasize for any loved one of mine who's over the age of 65 in particular, if they're in hospital, the day that they get better, that their loved ones come in and you get on the backs of the staff to get out of bed. No, you do not have your meals lying in bed. You sit in the chair, you walk around the room, you do laps around the floor, the ward, as much as you can to save yourself from this fate. I have seen it happen far too many times, and it would scare me absolutely for that to happen to a loved one of mine. Happens for a number of reasons. I don't think hospitals, they don't invest enough in physical therapy, mobility aids, nursing staff are too busy, and patients who are really wonderful, independent, driving, just lay in bed for days and they lose their muscle mass and they become very weak.
That's so true. I mean, losing lean muscle mass in someone who's older, it can be devastating. And, hospitals are understaffed. I think physical therapists are there to diagnose people that may need help, but they don't have time to actually do therapy in the hospital. And I think that's a fault in the hospitals to not invest. Because if you think about it at home, like when you have an infection or like a lung infection, it's not affecting your legs. So, but for some reason, hospitals, and they trap you. Those beds, if you've been in a hospital bed, you sink in. It's actually hard to get out of those beds. Especially if you're just not feeling well. And it's true. I've seen it so many times. It's a really, really good point, Suneel.
Well, I can tell you some of this comes from the government sets certain metrics that hospitals have to hit and be very, very careful with. And some of them are very good. And actually, one of them that's good is they track if you fall in the hospital and get hurt. And if you do, that's a reportable event to the government and the state. So what most hospitals do across the country is they overly keep people in bed to try to prevent falls, right? So they're very careful about letting them get up and walk around and things like that. The problem is that's actually counterproductive. People get weaker and they're more likely to fall. So what you're going to see is, your chair's alarmed, your bed's alarmed. Everybody gets upset if you try to go to the bathroom yourself. Now, it is meant to protect you from a fall, but in the end, you end up getting deconditioned. So that is something that I completely agree with you, Suneel. Getting up, moving around, discussing with the staff, hey, I'm mobile. I want to be moving around. If you can't get a physical therapist in with me, somebody else needs to be, because I am not going to get deconditioned, go to rehab.
Yeah, it's another example of these, big corporate hospitals not really, they're protecting their profits probably over patients in a sense. And you're right. I mean, they're playing more to the metrics. There's no metric saying like, the patient's been in bed too long.
Yeah.
That doesn't create money for the hospital.
Yep, it does. And I find it really sad. Frequently, loved ones will talk to me during the day, relatives of patients, and they will say, look, my loved one is here. Please, can they get out of bed? They are so weak. And I think to myself inside, you shouldn't have to do that. This should be protocol. Why are we not getting people up? Obviously, I'm very big on movement and exercise. I believe exercise is the second best medicine after food. But there should be something that is so obvious and not done. And it is just a huge red flag. And the amount of times I come in to start rounding on hospital patients, and they've been in for a couple of weeks, and I'll be seeing them for the first day, and I will think, you've barely moved. You've become deconditioned. I know exactly how this is going to play out. And sadly, often the patient themselves, often they're sick, and you do require a bit of a push. I'm not suggesting being inappropriate, making you run or anything, but if your goal is to regain independence, this is more a message for any loved one out there, an advocate coming back to that point. You have a loved one in the hospital. If you see this, it should trigger warnings in you that, no, this is weird. Their infection or whatever else they're in with, asthma, even a heart condition, it's getting better. Why are they not moving around? This is something that is completely unacceptable, and we need to get them moving again. Do you have any other thoughts on that, Ben?
No, there's a ton of complications that can occur from the lack of movement. I mean, bed sores, ulcers, injuries, more likely to fall, deconditioning, weakness, having to go to physical therapy. Yeah, this is a huge issue, and you can prevent it in a few ways. One, being physically active and strong before you come to the hospital. Two, doing everything you can do to prevent going to the hospital, but yes, sometimes it happens. And three, being your own advocate. I want to get up, I want to move, do what you got to do to let me up and move. So, huge issue. Totally agree with that point.
Well, we do hope that you got a lot out of that talk. We're speaking to you completely honestly and transparently. Thank you, Dr. Peter, for sharing your personal insight there as well. So the three things were advocacy, medications, and avoiding sinking in bed syndrome. All those things can happen very quickly. And the truth is that sickness is very unpredictable, and you never know when it's going to be you or a loved one. So it is really good. And that's one of our goals as well, for you to be informed, because that day will come for you or a loved one. That's the reality of life. And you have to know what to do, what to expect, and how to have the best possible outcome, which is what we really want for you. Thank you, everyone, again. Do feel free to leave a comment down below. We enjoy hearing from all of you. Again, check our separate exclusive channel where we have a lot of these discussions and we post some exclusive content. That link is down below. Also check the links for our natural health and wellbeing store, ohiwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK, Europe, we're very excited about our expanding natural health and wellbeing store. Take care, everyone. Stay strong, and we will speak to you in the next episode.